Quidel Corporation presents the QuickVue iFob test. This is a CLIA-waived rapid immunochemical diagnostic tool intended to detect the presence of blood in stool specimens. Blood in the stool is an indication of a number of gastrointestinal disorders, including colorectal cancer. There are 2 kits available. A 20-test kit, which is bulk packed for convenience. This kit includes everything you need for your patients to collect a specimen and for you to run and read patient samples. No additional equipment is needed. A 10-test kit containing just the patient specimen collection and return kits to replenish your supply is needed. This short video will demonstrate how easy the QuickVue iFob test is for your patients to use and for you to run and read the results. In order to use the test, you will need to have the following components, all of which are provided in the kit. Specimen collection and return kit components consisting of specimen collection tube with patient identification label, absorbent sleeve, specimen pouch, return mailbox, patient instructions. The test cassette sealed in a foil pouch, package insert, procedure card. Check the expiration date on each individual package before using. Do not use any test past the expiration date. The specimen used in this assay is feces. In most cases, the patient will collect the specimen at home. In some cases, the specimen is collected at the physician's office or lab. Note: patients with bleeding from menstruation, hemorrhoids, constipation, or the urinary tract should not be considered for testing until after bleeding ceases. Enter the patient identification information on the collection tube label. Note: it is important that during the collection process, the patient should not allow the fecal specimen to contact the toilet water until after the specimen has been collected. Patients should not urinate on fecal specimen or collection paper. The patient will follow the procedure outlined as follows. Raise toilet cover. Remove tape cover from each end of the collection paper. Position collection paper on rear half of seat, allowing paper to sag. Press the tape down on each side of the seat. Deposit fecal specimen on collection paper. Do not remove the collection paper from the toilet seat. Unscrew the sampler from the collection tube. With the fecal specimen still on the collection paper, randomly pierce the specimen with the grooved end of the sampler in at least 5 different sites. Insert the sampler back into the collection tube and firmly tighten it. Shake the tube to mix the specimen and the FOB buffer. Flush remaining specimen and used collection paper. Note: specimens collected may be stored up to 8 days at ambient temperatures, below 95 degrees Fahrenheit, 35 degrees Celsius, 6 months at 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius, or 2 years at -4 degrees Fahrenheit, -20 degrees Celsius. Note: all test cassettes and clinical specimens should be brought to room temperature prior to running the test. To run the test, remove the test cassette from the pouch and place on a clean, flat, dry level surface. Put on gloves before performing the following steps. Remove from mailing box if applicable. Remove absorbent sleeve from specimen pouch. Remove collection tube from absorbent sleeve. Shake the collection tube to mix the specimen and the FOB buffer. Hold the collection tube upright as shown and remove the light blue screw cap by turning. To avoid potential contact with specimen solution, fully cover the tip of the collection tube with the absorbent sleeve or like material as shown. Quickly snap off the tip. Do not twist. Holding the collection tube vertically, dispense 6 drops of specimen solution from the collection tube into the center of the sample well. Read results at 5 to 10 minutes. Some positive results may be seen earlier. Test results should not be read after 10 minutes. Refer to the procedure card for visual color interpretation of the test and control lines. Both the test line and the control line appear as a burgundy color. Positive result. If both a control line and a test line are present, the result is positive. A positive result indicates the level of human hemoglobin in the specimen is at or above the detection level, 50 nanograms of human hemoglobin per milliliter buffer, or 50 micrograms of human hemoglobin per gram of feces. Any intensity of a burgundy-colored test line is considered a positive result. Negative result. If only the control line develops in the control region of the test strip, the result is negative. A negative result indicates the human hemoglobin in the specimen is below 50 nanograms per milliliter. Invalid result. If the control line does not appear within 5 minutes, the result is invalid, and the assay should be repeated with a new device. Note: the test line may or may not be present. However, the absence of a control line indicates an invalid test. For assistance when running the QuickVue iFob test, contact technical support at 1-800-874-1517 between the hours of 6 a.m. and 5 p.m. Pacific Time. For additional questions or information on other Quidel rapid diagnostic tests, please contact Quidel Customer Service at 1-800-874-1517, your distributor sales representative, or visit our website at www.quidel.com.